Morning, sir.
Stephen, how are you? Morning. I hope, Stephen, you are sharing the slide from your end, ba?
Sir, yes, sir. I'm doing that from here, sir.
Okay. Thank you. No, Allah. Hello, good morning, Stephen.
Good morning, sir.
So what do we do is past 9.
Okay, I think we can start. So good morning, everyone. You're welcome on the call. We're having a 3-day meeting, and today is day one. Tomorrow will be day two, and on Monday will be day three. You're welcome all, and we'll start by having our opening remark by our Ed, Public Health Informatics Unit, Mr. Yashe. Over to you, sir.
Okay. So good morning, senior colleagues and colleagues. Thank you for
Mr. Stephen, you are breaking. Good morning.
creating time to be part of. Morning, Yetunde. Can you hear me now? Hello.
Yes, sir, we can
I
hear
think
you. Please go ahead.
we can hear you, sir.
Okay. So I thought somebody said it was breaking. That's why I wanted to be sure whether it's from my end or from the other end, but that's fine. So just to welcome everybody to this very important meeting and a very key milestone in the life of EIDSR in Nigeria. It has been really indeed a very good hard working from all of us to ensure that the SORMAS that we all know, we improve on it and see how we can move it forward. And we are happy to say yes, though so many has gone into it, time we have spent time and other things to ensure that it works. Now we have a system that we can also say yes, we have all contributed to it. So this meeting is very key because we want to use this opportunity to address and introduce us the new interface of SORMAS that we now currently have, though there are still plans in place to see how we can strategize this training to zonal training, or you can use what we use now to step down to the state. That is still in place. So I want to say on behalf of the DG of Nigeria Center for Disease Control, my director, Dr. Fatima Saleh, the divisional head, Dr. Montari Hassan, and the acting HOD, currently Dr. Tajuddin Arolo, to welcome everybody to this very important meeting. We will intend to take it very brief, so there will be room for everybody to speak at the end of the day if there are questions, but feel free and listen and interface as we go on. I also want to specifically thank our partner who has also put in their time and resources, especially IHV and the host of other partners that have always been part of this support. We are indeed grateful. So I want to say thank you as we will move ahead to take the agenda one after the other. It will be good for us to keep our questions. At the end of the presentation, there will be room for questions and everybody will be allowed to ask questions. So just document your comment. At the end, we'll give that room for that. So thank you, and over to you, Mr. Stephen.
Thank you so much, sir, for that wonderful remark. We'll be going to the next view of Optimized SORMAS platform, which will be taken by Mr. Yashe. Over to you, sir. Can you hear me, sir, Mr. Yashe?
Okay, can you hear me now?
Yes, we can hear you now.
Yeah. So thank you very much. So I will be walking us through a general overview of what happened and what we mean by optimized SORMAS platform, what has gone in. So it will be more to say that yes, we have been users of SORMAS over the years. And when we started it in 2014 after Ebola, it was something that was a novel idea that we have worked through across the year. We have used the system to respond to a lot of outbreak, though the number of the cases were smaller. So some of the challenges, we were not able to identify them at that time. But after COVID-19, we discovered that the data set are becoming so large, and we begin to see some of the challenges that we are not trying to resolve. What has been the challenges? One of the challenges is that there are cumbersome data entry processes. So you know that we are using generic CIF. It means that you have to scroll from each, and you will be the one to select the variable across over 170 variables that you will select for all the diseases. And we are looking at the data were becoming incomplete. They were taking more time, and it was becoming more stressful. And the second reason why we felt there would be improvement is because the system is becoming obsolete in terms of version. You know, SORMAS has undergone a lot of upgrade even from the global level, but because of some of the challenges, we've not been able to move with the stack as at the global level. So there was also need for us to update and see some of those features, how we can improve on it. And there are also been challenge of what? With the mobile application and synchronization. Even when you collect this information, it becomes very difficult for the information to sync. There was a time we did an assessment to see how long you can get information and it will sync. And it was surprising that it was taking longer than unexpected. And the mobile app was no longer working. And we also discovered that in time of performance of the system generally, it was suboptimal in such a way that it has affected the data quality. Anytime you want to pull down the data, you want to download the information that you have also put in, it will take a lot of time for you to begin to get those information. And the reason being because there are skip pattern in time of whether you enter value or you don't enter value, it adds to the weight of what you want to pull down. So this and many more has accumulated to what gave birth to what we call optimized SORMAS that Nigeria is currently doing. It's not a global SORMAS this thing. It is based on the need and what we felt Nigeria can do better. So in trying to do this thing, we agree that what are those key areas that there should be improvement. Though SORMAS is big, it does a lot of work. We may not be able to look at it whole. Everything as a stitch. So we are the problem we have with the application, we should currently doing by making sure that we upgrade users are the one detecting or suggesting what changes that should come in. Yes, if we are using generic CIF that cut across 170 variables for all the priority diseases that we are looking for 41+1, there is need for us to come back to begin to look at these specific diseases and see how we can modify it so that instead of you going to be the one to skip or to be scrolling across a list of 170 variables, we can make it more specific that you can select the disease and then just have those disease specific CIF that matters to that particular disease. And then we also say that there is need for us also to enhance in terms of the data management. If we are collecting data and these data are not really taking care of what we're looking for, if they cannot help in the management, then there will be challenges. And then we also agree that yes, we have been entering that at times they are there, maybe because of the bulk of the work, it becomes very difficult for us to begin to monitor the triggers or look at what are the threshold of some of these diseases. So we are also agree that there should be an outbreak trigger automation, so that if the disease have reached certain threshold, it should trigger an outbreak so that somebody need to confirm it. So basically, these are the changes that has been done on the optimized SORMAS for Nigeria that we are currently going to review today. And we believe that as we've started, it will be going to be a continual process. There will be improvement as you'll be testing it. We expect that you document your experience in time of what you are seeing. We can also use that one to improve the process going forward. And we also have plan to link the SORMAS with our laboratory information management system. You know, one of the challenges we have has been the issue of lab results. Even when the lab results are out, nobody, or at a certain point, people don't even update it. But if we have this linkage between SORMAS and LIMS, it means that automatically, once if the lab will do that from their LIMS, it can also pull it into SORMAS. And then the next step will also be for us to go back to our mobile app to say, yes, we really need to work on it and see, so that even if you go to where there are no network, you can even take in your data, and as you go to where there are network, it will begin to synchronize and sync into the system. So these are basically some of the major next steps that we'll be looking forward in the near time to come. So I will say relax and be attentive as colleagues will be walking us through the phases of the optimized SORMAS as we go across in the couple of these 3 days. We agree that it is going to be a very short presentation. It won't take more than 1 hour within these days that we'll be looking up, and the presentation will be made available for colleagues to have and even share with other colleagues as we continue to go. So on this, I say thank you for your time and listening. Over to you, Steve.
Thank you so much, sir, for that overview. So we're going to the next session, which is titled Optimize SORMAS case sample, optimize SORMAS case and sample entry, and I'll be taking us through that. So we know that SORMAS, before we can access SORMAS, there is a need to log in into SORMAS, and every user on SORMAS have their access, their username and password, which is a procedure to be able to access SORMAS. We would also be looking at the key variables that are essential. We know that all variables of SORMAS are key at this point, but we'll be looking at all those variables one after the other. We'll also be looking at what do we mean by data quality. We don't just want to be reporting on SORMAS. We want to have SORMAS that is reliable and that the data can be usable. So, and quality is a key part of this. So we'll be looking at how to improve accuracy, reliability of our data on SORMAS. Then we'll be lastly, we'll be looking at the sample leakage. How do we enter laboratory information for sample testing and on SORMAS? So for the SORMAS login procedure, some of us are familiar with the SORMAS login procedure, but I'll also take us through that. To be able to access SORMAS platform, you need the URL, which is the link to access SORMAS. And for what we have is https://sormas.org.ng, as we see on our screen. That is the link to be able to access SORMAS. We also have a pseudo platform, which is for staging, for practicing, for testing, but that is not for reporting live. But for reporting live on SORMAS, we have this link. And once you click on this link, it will ask you for your username and password. And as a user on SORMAS, either the DSNO, LG DSNO, State DSNO, or any at all levels, we have our username and password. So you'll be required to enter this username and password on SORMAS as provided to you. And once you do that, the next thing you should do is to verify that the connection is secure. So on top of the bar, I'll be demonstrating that at the tail end of my presentation. On top of the bar close to the website, the link, you should confirm that it is a secured connection and not just HTTP, but the S is there and the lock is there to show that it is a secured connection before you proceed. Then once you finish everything you want to do on SORMAS, it's advisable to log out after completing your work for data secured, for your secure data. Okay, so we'll be looking at understanding SORMAS case entry. We know that on the field, once we suspect a case, we're expected to go there, do case investigation with our case investigation form, and real time there and there, we're expected that you fill in the data that you have on your case investigation form into the SORMAS platform, which is which we need to do. And while doing that, we need to capture all the information that we have on the case investigation form, and I'll be taking us through some of those key information, key essential information, which include demographic details, clinical symptoms, epidemiological links, as we see on the right-hand side of our screen. The first set of information, once you log in, is you have different module. I'll be showing us that live on very soon. Once you log in, you have your module. You go to cases. Once you go to cases module, you will see new case on the top right corner. Once you click on that, it will bring you to this page, create new case. Once you pop this up, you have informations to fill, which you are expected to fill every information, starting from the disease selection, the date of notification, date of reports, responsible jurisdiction, that's the state, the LGA where this report is coming from, and EPID number, then place of stay, and the likes we expected to be filled. And you move to the next stage where you fill the demographic details, the clinical symptoms, epidemiological linkage, and vaccination history. All this information are key to any case that you are entering. And why are we doing this? Accurate case entry enables early detection of outbreak. It tracks transmission pattern and guide control measures. So we are not just entering data on SORMAS for entering sake. We are doing this because we want to detect outbreaks early, because we want to track transmission in our communities, in our LG, in our state, and want to also guide control measures to be able to respond fast and control diseases. Okay, so what are the key variables for case entry that we need to pay attention to? As I said earlier, every variable on SORMAS is important, but there are some key ones that you should also make sure that you pay attention to and enter correctly. The first one is the case identification, the unique case ID, the patient identifier. Some of these will be populated automatically on SORMAS, but the EPID number is also very key and important. Then we have the demographic information, which we have the name of the person, which is the first name and the surname. We look at the age, which is the age of the person by year. We'll also look at sex. Is the person male or female? Look at the patient address. Where is the patient coming from? Which state is the patient resident? LGA, you fill the address of the patient. You also fill the contact information of the patient and the phone number, and also the occupation and educational level, which are fall under the demographic information. Then we have clinical information where you fill the date of symptom onset, the symptoms and clinical signs that it's observed of the patient, which will be clicked on SORMAS platform. Then we have vaccination history and epidemiological information, which are expected to also fill on the platform. I'll show us this very soon at the end of this presentation. So talking about quality data entry, what are the principles of quality data entry? Number one is completeness. We have to ensure that we fill all mandatory fields without leaving critical information blank. And that's why we have made SORMAS optimized and user-friendly, so that you don't have a lot of information to fill and where you would now miss out some information. So we have made it very simple, very streamlined. So we expect completeness in filling our SORMAS data going forward. No field should be left blank. We must fill every field. Then accuracy, we must ensure that we verify patient information against source document before we enter. And our source document is our case investigation form. So we must ensure that any information we are filling on the case investigation form is complete and correct, so that by the time you're entering on SORMAS, you're ensuring accuracy. Then timeliness, we must ensure that we enter our data promptly after case identification or interview. So we should ensure that the period between the filling of the paper-based, which is case investigation, and the SORMAS is streamlined, less than 1 hour. if we can, so that we can ensure timeliness of reporting. So this is advised. Then consistency, we should follow standard surveillance definitions, case definitions, and coding practice. We should ensure that all the surveillance case definitions that for each disease is followed, and every principle that we have on our IDSR is followed while filling this data to ensure consistency. And what are the common errors to avoid? We must duplicate case entry. Let's ensure that we reduce duplicate entry. Let's confirm the cases and ensure that they are unique cases before we enter. Let's ensure that we do not fill incorrect dates or date formats. SORMAS has made it easier because they'll be calendar, so you have to pick the correct dates from the calendar, and we should ensure that that is correct. Then we should ensure that terminologies are consistent with the platform. If you are saying a particular thing for the address, let's ensure that we follow that term and the way it is written. And we should ensure that no mandatory field is missing or left unfilled. So what is the sample entry? We are moving into the sample part. Once you fill the case information part, it will ask you, do you want to fill, do you want to collect sample for this case? And once you say yes, it will ask you to add sample, as we see on our screen. So once you click on add sample, it will ask you information of the case record that you want to fill in. It will ask you this specimen collection module will pop up, and it will show you the information that you need to fill for that case concerning sample. So you will fill in the sample details, sample information, the laboratory you want to send it to, the kind of test you want to send it to. And this is very critical in our data entry on SORMAS. You don't stop at just entering case information. You have to move into the sample, because we expect that for every case, that is surveillance case, that suspected case that you are filling on SORMAS, that you should also fill the sample information. So sample entry enables tracking of specimen collection, transportation, and laboratory testing for disease confirmation and surveillance purpose. So this is very critical. You know, we cannot confirm any disease or any outbreak in Nigeria without lab confirmation. So we need to put the laboratory information as we are filling the case information. So what are the required sample information that we're looking at? We're looking at the sample ID, which is the unique laboratory identifier. We're looking at the date of collection, the date you are collecting the sample, the laboratory destination, where are you sending the samples to, the sample type, what is the sample type you are filling? Is it the blood, the swab, the urine? You have to fill it in. Then the collection facility, document the healthcare facility where this specimen has been collected, then the test requested, the analysis, the diagnosis test that you want to carry out. These information are very critical. Then quality sample entry best practice. We want to look at the best practices for quality sample entry. The first is to match sample ID to lab form. Ensure that the lab form you have or on your IDSR form or your case investigation form is matching with the information you are filling on the sample portion of the SORMAS. Then you also have to verify the collection date, ensure that the date you are filling as the date sample collected is correct and accurate. Then you have to confirm patient linking, ensure that the specimen is correctly linked to the corresponding case, surveillance case on SORMAS. Yes, on SORMAS. Then you have to validate the laboratory details, the laboratory name, the test. Okay, the laboratory name and the test requested should be correctly entered. So you must ensure that the laboratory you are sending the sample to is a laboratory that is supposed to test that sample. So this information should be confirmed before entry. So what are the key takeaways from this? Secure access. We ensure that we protect our login credentials and we have access to our user name and password at all times. Complete our variables, fill all mandatory fields. Quality first, let's prioritize completeness, accuracy, and timeliness. Then sample leakage, ensure that our laboratory sample collection information are filled on SORMAS during data entry. So I'll be quickly going through showing us the live staging server of SORMAS. Once you put in the URL, it will take you to this page. This is for the staging server. The same thing happens to the live server, and you're expected to put in your username and password. So once you put in your username and password, you click on login. And when you click login, you wait for some 30 seconds. It will roll and log you into SORMAS. So this will go in very soon. All right, so it takes you into SORMAS. And once you come into SORMAS, there are different modules, but for someone doing case and sample entry, where you need to go is cases. That's the module. So once you click on cases, it will load and open the case module for you. All right, so here you will see the blue button at your right top corner, which says new case. Once you click on it, on the new case, it opens up the case information that you need to fill in, and you pick the disease. Let's say cholera, I pick the disease and continue. Once you click continue, then it brings the information that you need to fill for you. So these are the information that I mentioned, the case investigation information, the patient information, the clinical history, the epidemiology information, the lab information. Once you say yes to this, it asks you, once you click on yes to this, then it asks you to add sample. Once you add sample, then you click on all the information that you need. So this is just to show us how the new SORMAS interface is. It's just one page where you fill all the information. So the next person that will be coming up will talk to us about how to fill in contacts. Thank you so much for listening. I don't know if you have any questions before we move on. Thank you all for listening. Do we have any questions? Just 3 minutes questions. If you have any questions, just drop it on the chat box. Okay. So let me just, okay, let me, all right. Okay, so let me,
Okay, may I go ahead? Good morning.
good morning, please go ahead, please. So we have
Okay.
Iwara, please go on, ma.
Yeah, thank you so much. Good morning, everyone. Yeah, I know a lot has really gone into this optimization, and it's really good to see. Okay, I was just wondering, I don't know if this would be possible immediately or in future updates. Once one clicks on the disease entity, would it be possible like to have that, there's one eye that comes up that has the information. Okay, so you could have like the case definition of that disease. It may not be possible now, but let's just have that so that it will just be a reminder for those who are filling the form. Thank you. This is really great job. Well done. Thank you.
Thank you, ma. That is well noted. Thank you, ma. Mr. Martin, you have the floor, sir.
Yeah,
Yeah,
Steven, thanks. I just wanted to drag our attention to this earlier. We need to find a way to ensure that we are conscious of the particular platform we are using. I know that for this demonstration, we are using the staging server. But for our LGA DSNOs, who are actually the ones capturing this information, we should ensure, we should work together. When I mean work together, all of us, myself, you, colleagues at the state, to ensure that at every point in time after this training, they don't make a mistake of entering a case on the stage, thinking that should just find a way to ensure that this notification or this error does not occur. That's what fear people might not be able to differentiate. So we need to find ways before they even begin to enter a case. So example is making sure that you look at the URL before you continue. So that's very key. Thanks.
All right, sir, that's noted. We would ensure that would notify all the surveillance officers to be able to identify the URL and take caution before entering cases to ensure they're on the live server. Thank you so much, sir. Musa Ibrahim. So that will be the last question we'll be taking before we move to the next session. So Musa Ibrahim, you have the floor. You can put off your video. Yes. Okay. All right. We're listening.
Hello, good morning, my senior colleague. Thank you for giving me an opportunity, and then this is very nice presentation. So having, these cases are entering from our surveillance SO and CO, our surveillance officer at the LGA level, and also our CO, that is our contact officer at the LGA level, that is the ADSNO. So how do you plan for them in order to, ensure that this optimization that they have carried along? Secondly, you have to, before entering cases, you must use this URL before entering, because as before, when someone's been optimized, so you have to use, there's a web, and then there is application, because we normally discuss with the LJDSNO. Some are saying the application is more friendly. Some are saying they are more web is more friendly. So now this URL is under most. You have to make sure you put it in the tab or in the apps, new apps, before to use it. And then finally, please, you need to follow up with the other recent training that you did, especially some of the health facility does not have a username, especially in my state, Zamfara, because when the trainers went there, they are yet to send the username and password to the health facility. So thank you. Over from myself.
All right. Thank you so much, Musa, for that. That has been noted. We would reach out to you to support your state on the login process. Concerning the mobile application that you're requesting for, that is still ongoing. Once that is sorted, we'll fall back to the mobile application. But currently, it is the web browser application that everyone is using for now. So it's just to be clear on that. Thank you so much for your comments. So we're going straight into the second session, and we'll have Vivian on the call to take us on the next session. Vivian.
Thank you, Stephen. Good morning, colleagues. Please, can you confirm you can hear me?
Yes, we can.
All right, thank you. Please, the next slide, please. So I'll be taking us through the SORMAS contact entry session. Before we start, it's important for us to remember that a contact is a person who has been exposed to a confirmed or probable case of an infectious disease. And what this means is, for you to be able to create a contact, that contact must have been linked to a case of an infectious disease. So next slide, please. Next slide, Stephen. Okay, so the first step in creating a contact, like I earlier mentioned, every contact must be linked to a case. So if you once you log into your SORMAS using your provided username and password, you will have the home page that will be displayed, and then you have all the modules to your left-hand side. So if you go to the contact module, you will not be able to enter a new contact, and that's because it must be linked to a case. So you have to, first of all, go to the case module, then identify the case for which you want to create that contact. Then you click on contact, which is just beside the case, as you can see in your right-hand side displayed there. And then you click on new contact. So next slide, please. I'll show us all of this in our live demo. Okay, so once the contact form has been displayed, you fill in all the necessary information, especially information that has been * read, which indicates that those are compulsory variables that must be filled. And so when you are done filling the accurate information, then you save. And once you save, this means that contact has been created and is stored in the SORMAS database. However, if you discard, it means that contact will not be created. So it's important to take note of this while saving or discarding. So after saving, another page or another form will show just beside the contact form. We'll see all of that in our live demo. And then you can add contact follow-up visits. And the importance of this is, that's not enough for you to just line list the contact. You also need to monitor that contact based on the follow-up period and the incubation period of the infectious disease to see how that how the contact presents over that follow-up period. So it's important for us to always add our contact follow-up visits. As you can see to the right-hand side, you see where to add. So once you create the contact, you have a follow-up visit, and then you can add new visits. So you can add as much visit as you can, and depending on how many times you go to monitor the contact. So next slide, please. So just in summary, you have to log in, then select the case person as to which you want to link the contact to. You create the new contact, you save, and you add your follow-up visits, and remember to save as well. And also just to reiterate that every contact must be linked to a case. Next slide. So to edit a contact, you log in also on SORMAS, you click on the contacts module. So now this is where you go directly to the contacts module. So you click on the contacts module, and then you have your contact list displayed. And then you can either use the show more filters or the filters to search for your contacts. So when you are done imputing the details of the contact you would like to search for, you apply the filters to display your results, or you can reset filters to clear what you have imputed. And you can also, another way to search for your contact as well is to go directly to the contact list and then just click on the contact ID of the contact you would like to edit. Just a reminder as well that you can only edit a contact that you have previously entered and saved on SORMAS. So next slide, please. Okay, so once you click on the contact page will appear, and then you can click on edit contact, which shows to your right-hand side, and you can update any necessary information you like to update, and then click save. Also, just ensure that every information field is accurate and complete. So next slide, please. So reason why you like to edit a contact is to update the contact information, update the exposure. Maybe you got an additional information on the exposure details, or you would like to update the follow-up info. Maybe it was a loss to follow-up. You'd like to update the follow-up information. You got maybe the follow-up is completed. Whatever information you would like to update, you could always go to the edit contact and then edit the contact information when necessary. Also, a reminder to always save your changes after editing. Next slide, please. So in summary, for you to edit a contact is almost similar to creating. You log in, and then you go to your contact module. So in this instance, you're not going to your case module anymore. You're going to your contact module. Then you select the contact person, edit the contact information, and then most importantly, you save. Next slide, please. So these are the best practices for contract entry. Edited the slide statement. So enter the cases immediately after identification, verify the information of the contact, and then ensure complete and accurate data. Then regularly update your contact follow-up visit status. Okay, next slide. So the key takeaways, contact entry is essential for outbreak control. You all agree with me that for you to be able to break the chain of transmission, it's important that once you have identified a case, the next key step, aside taking the sample, is for you to be able to identify the contact to break the chain of transmission. Every contact must be linked to a case and then ensure complete and accurate data entry. This is also to help in contact monitoring, because if the information is not accurate, then it will be very difficult to monitor that contact. And then, of course, timeliness. Stephen made mention of one of the key data quality variables, which is timeliness. Timeliness is also very important. Aside from identifying a case timely, it's also important to identify the contact timely, so that you do not start contact monitoring when the contact has already shared most of the virus to a lot of people. So yeah, timely entry of contacts is very important for timely contact monitoring. So next slide, please. I think this is all. Thank you all for listening. So I'll just quickly do the live demo. Okay, so I'm sharing from my end. Okay.
Yes, you can share from your end.
All right. Okay. So as we all know, please confirm you can see my screen.
Yes, we can.
Okay, thank you. So you log in using your provided login details. Just a reminder, this is the staging and this is not the live SORMAS version. And like I said, if you go to contact, you won't be able to create a new contact. So if you see, you can't create a new contact. So you have to go to cases, because all contacts must be linked to a case. So I'll just use one of these cases for to save time. So identify the case you would like to link a contact to. So we'll just use the first one here. Click on the case ID, or you can use your filter to search for the case. And then, sorry, let me move this a bit. And then you click on contacts. The new contact. Then you can fill all the necessary information. If you notice to your right hand side, this is the case information that you're linking the contact with. So you create all the necessary information. So the moment you save, you would see another page. I don't know if I can quickly do this. You see another page that will come up for follow-up visit, and then you can fill that page when necessary as well. Yeah. So thank you. I think this is it. Or Stephen, do I need to fill all these variables?
It will take time. We still have one
Yeah.
more session, but during Q&A, if we have enough time, we can do that. Just take them through. We'll do that at the end. Let's take the last session. Thank you.
Okay. So thank you guys for listening. I'm open to questions.
Thank you so much, Vivian, for that presentation and the demo. So I think while we'll be taking the next presentation, you can quickly fill a contact, then so that it can open the follow-up for you. So when we come to questions and maybe question and answer session, we can quickly do that if we have time. So I think we'll have to go to the next presentation. When we are done, we can now come back to the questions and answer session. But briefly to summarize what Vivian has presented, is just for us to know that is for the contacts are for diseases that need contact and follow-up. As we all know, we have 25 case-based diseases that we reported on SORMAS. And I think less than about 7 or 8 that will do contact tracing. So if it's possible, I think for others that don't even need contact tracing, we can deactivate the contact tracing session that is beside the case, so that people don't enter a case and at the same time enter contact. I think these are things we need to inform our health facility and the LGA team that are not presently, maybe most of them are not presently with us. So that's one. Then we should also remember that when entering contact, we must enter the contact to link to a case. I remember in the previous SORMAS, there's a section where you just go to contact and enter a contact, but thank God this optimized section has been deactivated. When you click on contact, you can't be able to enter contact, but you have to go through the case to enter the contact. So these are some of the informations we need to pass through when we are training our health facility and at the LDA level. So we'll quickly take the last one, or we'll have enough time for the questions and the answer session. So the last session talks about optimized SORMAS lab result entry. So after entering a case, we'll definitely enter samples, because we know we're actually doing routine surveillance. So I'll hand over to Esther to take us through that before we open the floor for questions. Thank you. Esther, over to you.
Okay, good morning, everyone. Can I be heard?
Yes, you're audible.
All right. Thank you. I'm Esther, and I'll be taking us through the result upload on this optimized SORMAS. Next slide, please. So why is accurate and timely result upload? Why does it matter? Previous slide, please. Yes. So this matters because it ensures correct case classification. I mean, with all that Mr. Stephen has shown us and with what Mrs. Vivian has shown us, we can see that the case is suspected and cannot be positive or classified confirmed for contact tracing to happen if there's no timely result upload. So this also supports reliable surveillance data. It enables effective outbreak detection and monitoring, and it improves data quality for epidemiological analysis. I mean, Mr. Stephen also mentioned it in his presentation, that it's important for completeness, and completeness is also an aspect of data quality. So accurate and timely result upload encourages rapid confirmation of suspected cases. Also, it improves early public health response and intervention, as well as efficient contact tracing and case management. So overall, there's real-time dashboard, and then there's also real-time decision making. Next slide, please. So what are the steps to upload results? Now, there are two ways, or there are two directions or directories we can go through. First is the case directory, and second is the sample directory. So we'll start with the case directory. The first step is to log in to the optimized SORMAS using this link here and using our designated login detail. Next will be to select the case directory. Then we enter the case ID or EPID ID of the case that we want to upload the result and apply filters. We edit the sample entry, add a new test result, save, and be sure that it's been submitted. Next slide, please. So this is uploading result using the sample directory. Again, you log into the optimized SORMAS, you select the sample directory, enter sample ID or case name and apply filter, add new test result and save. Now the difference between here, that's the sample directory, and the case directory is that if you're following through the sample directory, it takes you straight to adding new test results. Once you've applied filter and the case has come up, you've retrieved the case you're looking for. Once you open that case, it takes you directly to adding new test results. Meanwhile, for the case directory, you need to edit the sample entry. And we'll see this in the pictures attached. Next slide, please. Okay, so this is going through the case directory. And as the arrow is showing us here, Once you click on cases, the next thing you do is to search using the EPID number or EPID ID. Next slide, please. Good. So now, once you have retrieved the case, we can see the arrow showing us to click and edit sample entry. So that must happen before you are able to enter a new test result. This is if you're going through the case directory. Next slide, please. Okay, now, if you're going through the sample directory, once we have applied filter, next slide, please. It brings us directly to this place. There is no need to edit sample entry or anything. That's the major difference between the case directory and the sample directory. Next slide, please. Now, once we have clicked on enter new test result, this is what is expected of us to do. So we are expected to enter the type of test that has been performed. We're also expected to enter the date and time of result. We're also expected to verify the testing laboratory. I remember the previous presenter telling us that it's important for us to enter the right laboratory for the disease that we're uploading. And then it's also necessary that at this point of result entry that we verify that that laboratory is correct. Next is we should record the test result, whether positive or negative or indeterminate. And then we should also not forget to tell whether this has been verified by the lab supervisor or not. Now, the good thing is these are very mandatory variables. So without filling them, there is no successful laboratory result entry. Next slide, please. Now, what are the key tips and best practices? So it's expected that laboratory results are immediately entered after validation. What does this mean? As soon as the result is out, the result should be uploaded. Meaning if result is out today, at least within the next 12 to 24 hours, it should be entered into SORMAS. Now, it's expected that we should ensure correct linkage with case or contact records. This is why we are creating, or this is why there's an option of uploading results through the case directory. This ensures that the result that you're uploading is for the right person or for the right case. Also, verify sample ID, dates, and test result before saving. Yes. Avoid duplicate entries. I don't know, for some reason, maybe network, you can enter new test results twice and it may look as though that sample has been tested twice, meanwhile it's once. So let's avoid duplicate entries and also update pending results promptly. Next slide. So this is the end of the presentation. Any questions before we go to the demonstration?
Okay, expert, kindly demonstrate. After demonstration, we'll take questions.
Okay.
You can share your screen.
Okay. Please, can someone confirm if they can see my screen?
Yes, it's up.
All right, thank you. So yes, this is the first step to log into SORMAS, although this is the staging SORMAS just for demonstration, but for the real life upload, we'll be using the live SORMAS. Now we'll log in with our designated login details or login credentials. And once we do, the first step is to come to the case directory, if that's preferred. Then, for the purpose of practice, I'll be copying this appeal ID. And then we apply filter. Now this case has been retrieved. Next is to open it up. And then we have to edit the sample entry using this pen icon here. Once that is done, we are able to enter new test results. So we add a new test result. Now, we're supposed to verify the kind of test that is being performed, which is PCR. Now, verify the laboratory. Yes, this is Lassa. Then we'll verify if this laboratory tests for Lassa. If yes, then we leave it. If no, please, the correction should be done and feedback should be given to whoever created this case. Now, date and time of results today. Test result, negative. Verified by lab supervisor, yes. Done. So this is done. As you can see, the result has been uploaded to negative. So now, this is through the case directory. Then we'll be coming through the sample directory so that we can see the difference. So now at the sample directory, we are also expected to come here and impute the sample ID or case name. Now for the purpose of this demonstration, we'll be using the case name and would apply filter. Should no record found.
Yes, you're a bit loud. People are saying they can't hear you well.
Okay. Okay, so I said for the purpose of this demonstration, we'll be searching using the case name. And now the case has been retrieved. So what next? We open this case and we can see that it brings us straight to where we can enter a new test result, unlike when we came through the case directory. So we would add the new test result, ensure that we indicate the right type of test. Now, the first result we entered, it was Lassa fever and it was PCR. Now, this is cholera and the type of test is culture. Now, the laboratory is NRL. If there was another lab other than NRL, it is important that that is changed to the correct laboratory. Now, date and time of result is today. Test result is negative. Verified by laboratory supervisor, yes. And then we save. Now we can see that the result has been updated to negative. So this is how to successfully enter the lab results for this optimized SORMAS. Thank you and over. Any questions?
Okay. Thank you so much, Vivian, Esther, for this demonstration and also the presentation. So it's time now for us to take questions for both the contact entry section and also for the sample entry section. So please, if anybody has questions, you can do that by raise of hand, and I'll go with the hands that are raised. So any question, please, across the states that are here with us. Because I know most of us are users of SORMAS across the state, but this is actually for us to step this down to the health facilities that have been deployed and also for the LGS. So if you have any concern, it's better we raise it now so that we'll be able to clear all the concerns, pending when we go down to our health facilities to also down this page.
Esther, please stop sharing your screen.
Okay. Steven, I think I can't see any hand up. And we still have a little more time. I don't know, Steve, if we can quickly show the follow-up section that was missed out in Vivian's presentation. I think we didn't do that demo. That will also be very important because it's for diseases that need contact tracing. We need to fill the contacts and do the follow-up for the accurate number of days that is needed.
Okay, sir.
Yeah.
Okay, sir. So what we'll do is I would do the demo from here. We'll start from the case entry one after the other. We still have like 20 minutes to the end of the meeting. So we'll take the case entry one after the other. We'll go into the sample entry. We'll go into contact entry, then laboratory result entry. So we'll just demonstrate that. Then we can round up after then. Okay, so let me go straight into this.
Okay.
So please, let's fill the attendance sheet if we have not done that. Okay, so let me start from the beginning so that we can see. So once you open your browser, I'm opening a new browser now. Once you open your browser, be it Chrome, any browser you use, this area of the website where you type in the website is where you enter in the username and password. So once you type it in, sorry. So once you type in, we are using staging because we are practicing, we are training. Once you want to enter your live report, it is the main server you use. So for the practice, it is staging. It starts with staging.sormas.org.ng. But the live server starts with SORMAS itself, sormas.org.ng. That's the difference. So even the staging server has a warning message on it once you log in, which will flag you that you are on the practice server, so you don't report a live report on it. So we're entering staging server, which is staging.sormas.org.ng. Once you click on it, it will roll for some seconds, then it takes you in. Once it takes you in like this, the first thing you will see is the warning, which is telling you that it is a staging instance. Data can be wiped at any time. So it shows you that this is not a right place to report your data. So this is for practice purpose. So please, let's all note this. It's very important. So the first thing you see, different module on your left-hand side, from the home, the dashboard, the task, the person, the cases, the contact, sample, aggregate, SORMAS GPT, outbreak, configuration. All of this has their purpose, what they do. Task is for task management. Person is for person directory. Case is for case directory, where we enter new cases and sample entry. Contact is where we have our contact directory. From cases, we can also pick and enter our contact. I'll demonstrate that. Sample, we have a sample directory where we enter our sample result. Then outbreak for alert notification, it has directory for alerts or triggers that someone has picked up, then configuration for other settings. So we are going to cases because we want to enter new case, right? So once you click on it, it will roll for a second and it will come up. So this is the case directory to bring it to. So for every jurisdiction, be it LGA, states, national, you have the directory of the cases that have been entered in that jurisdiction, in that area. So if you're LGA DSNO, you are going to be seeing directory cases that have been entered under your LGA. If you are health facility focal person, you'll be seeing cases that have been entered from that facility. If you're at the state level, you'll be seeing data that have been entered, cases that have been entered from that state. So I want to enter a new case. Where do I go? I click on the new case on the right hand top corner. Once I click on it, so we see that the staging SORMAS brought me in directly because I've logged in before. So it's not Once you are clicking in, it will ask you your username and password, and you put it in, and it will log you in. So it's loading the new case, just less than a minute loading. Okay, so as we can see, the first thing it's asking us is, you want to create a new case, which disease? So you must know the disease you want to create the case for. So we are going to pick one of the disease and just move forward. So we have a lot of diseases here that we can pick from. So you pick the particular disease that you want to fill the case for. So you click continue. So once you do that, it will load and bring up the page where you will fill in the information. So the first thing you see here is in-country point of entry. And in-country is inside the country, right? Which is majority. Point of entry borders, either border of the country or border of any of the borders we have in Nigeria. So you click in-country. Once you click on it, it will load and you can start filling. It has shown us that disease is Lassa fever because you have picked it before. The date of report, you pick the dates of the report, the dates that you are filling that case on SORMAS. You click on it. Then the date of notification, the date you were that notification came for that suspected case. You click on it. Is it a day before? Is it same day? So you click on it. Let's assume same day. Then the next thing is responsible jurisdiction. Which states are you from? Is the case coming from? Then you type, let's just type one of the states. Sorry. So you type one state. Then you pick an LGA where that particular case is coming from. So just pick it. Temporarily now, we are having a manual entry of the PID number because we are trying to sync the previous old SORMAS and the new SORMAS, right? We have some data on archived on our old SORMAS, and we have the new platform now that we are reporting. So they're trying to sync it in. Once it's completed, the PID number will be generated automatically. But for now, you are allowed to put the correct PID number. So let's just say this 001, right? So then you have an option to click if the place of stay differs from the responsible jurisdiction. This is saying that the place where this person is staying is different from the LGA where it was detected from, because people move from LGA to LGA, state to state. So you can click if that applies to you. So you now click the place of stay. Is it facility? Is it home? Is it community? Where did we detect this from? So you click on, let's say we click on home, then you type in the address. If you click on facility, you choose the facility where this is detected. So it will now tell you to describe the place of description. Let's just say Atauja, right? But if it's facility, you click on the facility and choose the health facility where this case is detected from. Are we together? So, okay. Please, let's desist from typing on the screen, please. Okay, so we can just pick any of the health facility. Let's assume it was detected at the health facility. So then the patient information, will go straight to put in the patient information. Let's just put a name just for training purposes. Then the date of birth expected, the year is compulsory. You put the year of the person. Just pick a year as you see it on your case investigation form. If you have the month information, the month of birth. If you have the date information, you put the date of birth. So sex is the next thing you put. Is it male or female? You pick. Then the state of residence, where that case is living, you put where the case is resident. You put the LGA. So you put the LGA, you fill in the address, then the patient phone number, very important. If the person does not have a phone number, the caregiver, the closest person, you enter the phone number of the person. So then the occupation, what's the occupation of the person, you fill in the person's occupation. Is he an healthcare worker? Is he a student? Is he a businessman? You have to fill in the occupation. So each information you fill, it tries to load and sync it with the database. That's why we see someone's roles after each entry. It's taking some time. Okay, so I think network is okay. So the network is up. So we pick the educational level 2. Let's say tertiary. So sorry, I have to quickly fill something here. Okay, so you pick, is the person hospitalized, either yes or no? Let's just pick no to go on. If you pick yes, it will ask you where is the person hospitalized, the hospital number, the person has gone, hospitalization status. So let's just pick because the person has gone, you say yes or no, then the admission date you pick and all of that. But let me just pick that because of our time. Just showing us this so that we can take note of this. Then the next thing is the patient condition of the patient. Is the person alive or dead? You pick the accurate information. Then the clinical history, signs and symptoms. You pick when is the symptoms onset. Is it 3 days before? Is it 4 days? Is it same day, previous day, 2 days? You pick the exact date of symptom onset. Then fever, you pick the symptoms that the person is having. You click on. So you have 3 options here. You can click on select to know. Then you now pick the one that is yes among it, right? For fast entry, right? So, or you can set clear to unknown, everything unknown. Then you now pick the ones that is yes. But the best is set clear to know. Then now pick the ones that the symptoms that the patient has. Then the next thing is what's the first symptoms that the person experienced. So you have to search for the symptom, let's say fever. So click on refresh first symptoms option. It will filter all the options you have picked up there. Then you pick one. Then any other symptoms, either yes or no. Then you go to the vaccination history. Is the person vaccinated? Yes or no. You click if the person is vaccinated, what's the number of vaccine doses the person has received, 1 or 2. For Lassa fever, we know there's no vaccine yet, so it should be no. For other diseases that have vaccine like measles, yellow fever, and lice, you put yes and you fill in the details. So exposure is free. This case linked to a contact tracing list. You have to confirm if that person is linked to a contact tracing list, and you put the epi number of the source case, you type it there. Then in the 3 weeks before you became unwell, do you have contact with confirmed Lassa fever case? So you want to confirm if the person has had contacts. Then in the last 3 weeks, did the person have contact with any unwell person? So the person might not know if the person is Lassa fever confirmed, but if the person they had contact with is the person unwell, so the person will fill and you fill the details of the contact of the person. The date of the contact will be filled, then the contact list will be description will be filled. So this is very important to be able to track and help with contact tracing. Then do you travel away from home in the past 3 weeks? Yes or no? You click on it. If it's yes, you put the details of where you travel to. Then these following questions about road and environmental part of it. Did you have any contact or you want to grow then so you fix the accurate option for the case that you're filling? I'm just filling all this to know for the purpose of data entry. So what type of shelter do you live? So you have to put in the kind of house the patient, the case live. So then in the last 3 weeks before you became aware, did you participate in any form of burial rites? So you click on it. Then another question is about, have you ever had a laboratory positive test for Lassa fever? As the person previously tested for Lassa fever and was positive before, then the patient test for or any other infection, positive for any other infection, you click. So now we move into laboratory, then you click yes. Of course, you're expected to collect sample from that person. Then you click on add sample. Then you click the date the sample was collected. You click on the sample type that you are collecting. You click on the states. So state you are sending, let's say, Abuja, just FCT. So once you click the state, it will bring the laboratories under that state. This is to reduce the long list of laboratories. So where is the state where the laboratory you are sending the sample to is, right? So once you click Abuja, it will bring all the laboratories in Abuja. So you can just search through the search button. So once you click some option on the search button, it brings up the laboratory. Then sample order, is that the first sample you are taking? Is this the second? Is it a first lot of sample? Then you put the sample number as you see, as you have it on your case investigation form. Then what's the reason for sample collection? Is it for screening for outbreak? So just you put in the details of when it was sent and other information. So this is for the sample entry. We're going to be going straight into the contact part of it. Still rolling. So I want to really round up in the next 2-3 minutes so that we can, okay, so dispatch, say yes, date you sent it to the laboratory, especially that once you collect sample, you don't let it stay down, you send as soon as possible. So dispatch details, you put it and you say done. So once you do that, it will save the sample information for that case, right? Then if you have any other information you want to fill, then you fill it in. Then you click on investigation. Have you done the investigation of the case? You said done, then you put in the details of when the investigation was done. So date of investigation, you click it in. Then once you fill all of this, then this last part is to tell you the paper, have you transmitted it to the district level? Have you sent it to the state? Have you sent it to national? So you can pick the date where you sent it to the LGA, you can pick the date where it was sent to the state, and you save. So are you sure you want to submit? You click yes. So it says, so you see this option is saying, please check your input. Obviously, there's a point where it's a compulsory field, which was not filled. See it here. So the SORMAS is smart to show you where you have not filled the information. So you're expected to come here and fill information. So an LGA name was not filled, and it's flagged it. So it's better to come back here and fill the LGA name. So let me just go back here. So you fill it in as needed and you save. Okay, so once the case is saved, the next thing is to, so this case is saved now. So the next thing we want to do is to go to the contact, right? And fill information of the contact of the person, right? If the disease is the disease where we do contact tracing, you're expected to fill in the contact of the person. So you click on new contact and it pops up the page to fill in the details for the contact. When are you filling this contact report? You fill the date in. What is the responsible state? You put it in. You put it in. Responsible LGA, you put it in. The first name of the contact person, you put it in. So we are doing this demonstration so that we can, so the year of birth of the person, you put it in. This is for the contact now. You fill in the sex, fill in the state of residence, every other information you have on the page, you have it filled in. So just fill in this for the purpose of demonstration. Any information we are filling on the SORMAS must be true and verified information. This is just for the purpose of demonstration. So you fill all the information that pertains to the contact. Once that is done, fill, then you save. I'm going to skip this because of our time, but these are the information we have. The contact data, is he a returning traveler, the type of contact you fill it in, the relationship with the case, quarantine, epidemiology information, and you save. But I'm going to discuss this because I quickly want to touch sample laboratory results because of our time. Okay, so you go to sample. Let's assume the lab focal person or the laboratory officer at the lab where the test was done wants to fill in the lab result. The person comes, locates the case from the list, or you search for the name of the case, right? Then you click on it. Once you click on it, it brings the person's case information. Then you see on the right-hand side, pathogen test, new test result. You click on it, new test results, and you put in the type of test that was done on the sample. You pick the date of the results. You pick it, the test results. Is it positive? Is it negative? Is it indeterminate? You pick it. Then the test result, if there's any test result details that you want to add to it, there's a box to type it in. Then is this result verified by the lab supervisor? Yes or no? Then you click on done. Once you do that, it saves the result automatically. You see, it's a very short process, but it's a key process because we have in our previous SORMAS platform, we have so many samples collected, but few results entered. But going forward, we want to make sure that 100% every case sample collected and tested, the result is reflecting on SORMAS. And we have all our corporations to be able to do that. So that's for that. We'll be taking next session tomorrow, same time, 9 to 10:30. And I don't know if we have any other question before we round up. We have less than 5 minutes to the end of the meeting. Do we have any comments on this? Okay, we have a hand raised. Fatai.
Fatai, sorry.
Good morning.
Your hands are...
Yeah, good morning. Thanks for the presentation. So please, I don't know if you can just scroll up to place of stay. Yeah, for the case you just created. So there's a particular question there that said that place of stay is differ from the responsible jurisdiction. So the answer yes. And there is a box. Okay. Yeah, this place of stay of the case differ from responsible jurisdiction. So please, I want you to explain that line. That is one. And secondly, you say date of report, the day we are entering that case on SORMAS. So I was like, date of report, because before now, as in before today, so date of report is the actual date the sample was collected. That maybe if the sample was collected today, but due to some challenges, they are not able to enter it on SORMAS, and maybe the following day, they want to enter that case on SORMAS. So which one will now be the date of report? Was it that yesterday that the sample was collected, or the actual date they are entering that case on SORMAS, which will be now a date of creation? Then for this responsible jurisdiction, in my own way, I just want to say it, if I'm right or wrong, so you correct. Are we clicking that box if the patient is visiting a facility not in his local government, or if that patient is not staying in our state, maybe I'm in Osun State now, and the patient visited an health facility, but not from Osun State, but maybe on his way traveling, so he visited an health facility. So are we clicking to show that this person is not in our jurisdiction, that is not in our state or that local government? Thank you.
All right, thank you so much. Let me quickly attend to that. First and foremost, this box is kept there because we know that people move from places to places, right? Place of stay is telling us where did we detect this case? Is it at the facility? Is it at home, right? Or in the community, to put the details where this case was found. But if that place where the person was found is not that person's, is not under that LGA of the place. For example, if the person was found at home now, and that home is a different LGA, different states from the state where this report is coming from, right? That is where you click it. For example, this person was detected in Ondo State, and the responsible jurisdiction where this case investigation was done is in Osun. That is where the LGA of filling this information is from, right? Then you tick this to notify that where this person was detected is different from the responsible jurisdiction. And when you say responsible jurisdiction, we are saying the reporting structure. You know, for IBSI, we have a reporting structure: the LGA, the air facility, the LGA, the state, and the national. That's the responsible place where this is coming from. But for the identification of the case, where did we take the case from? If it's different, then you tick. If it's not different, it's the same place, then you leave it blank. And concerning date of report, so for filling of this, the date sample was collected is under laboratory sample collection part, which is down. That's where you put in the date of sample collection. But date of report is when are you reporting this case, right? On SORMAS, when are you reporting this? You click on it. Then date of notification is when this information of this case came up, right? So there are two different information. So you don't have to backdate the date on SORMAS. It's the date you are entering that you put on it. And that's why we are talking about real time. SORMAS is structured to the real time. We don't expect this lag timing in filling information on SORMAS. The best practice is that the date of report will be almost the same date as the date of investigation. That is the planned structure for SORMAS. So let's take note of that. If the sample was not collected the same day, the date of report must carry the date this report was entered in SORMAS. While under lab sample collection, you put in the date the sample was collected. I hope I'm able to answer your question. We have other hands up, but our time is fast running. We have 1 minute for our questions. Tomorrow, you have the floor. Just 1 minute. Thank you.
Yeah, okay. Thank you so much, Stephen. I think you've actually answered those questions well. So we'll take all the questions together. Then after that, we are going to answer the questions. I think that will be faster. We have 3 hands. So Dr. Atumoro Francis 1. Okay, I think it's 2. Then Ebe Ruben, please. Can we take the 2 questions so that we'll answer those questions and wrap up? Over to you, please. Francis and Dr. Ebe Ruben.
Hello, Christopher and Stephen. I think we can go ahead to say that as many that has question, they can drop it as comment on the chat. We'll try to address those questions, even though if we don't have time to answer them today. It seems those people that have questions, maybe they are not getting, or they have difficulties in trying to speak. So they can drop it so that we'll try to be timely and ensure that other people too have other engagement. Don't forget today, we're having Lassa Fever meeting going now, starting by 10, and we're already 30 minutes into it. So I will suggest that maybe we'll bring this meeting to close and allow people to drop their question as comment, and then we get the answers back to them, just for the benefit of
Thank you, sir.
everybody.
Sir, you can take the closing remarks, sir, so we round up.
Yeah, just to say thanks to our colleagues that have taken time despite the short notice to be in this very meeting. Maybe today being the first, we had up to 160 something participants. So we're encouraging all the state and our SLO, DCs, and the state DSNO, please to kindly extend this invitation to the local government DSNOs so that they can also join. I think it has been so interactive. We want to appreciate you for your feedback. Feel free to provide more feedback even after the meeting if you have anything. So we are also trying to plead your indulgence, knowing very well that tomorrow is a weekend. We appreciate if you can borrow us your 1 hour, 30 minutes tomorrow just to have seen. So on this, I want to say thank you for attending and thanking our partners, IHV, WHO, RTI, many of them that I can't mention them all, like I saw them on the call, that will continue to engage and will begin to diversify this training down to the grassroots, that people will all benefit and will also have a better system that work for us as a country. Thank you and over. Bye.
Thank you, sir. That's the end. Thank you so much. Tomorrow night to 10:30.
Bye.
Thank you. All right.